Hello, hello. It is B with the B code Alpha Female Talk. Welcome back to my channel. For those of you who've watched, liked, subscribed, and commented in the comment section. So, first of all, I'd like to say thank you, or second of all, I'd like to say thank you to all of my subscribers and those who watch my videos. Please hit the thumbs up, thumbs down, subscribe, share, and comment in the comment section below when I am done. So, y'all know how it be with me. I be out here in these YouTube streets all hours of the night, all hours of the morning, all hours of the evening when I have the time. So, how do I want to say? I was strolling through these YouTube streets and came across a couple of videos by this nurse. And let me just go ahead and tell you what her channel is. It is OurNewForever. And, I get really, really excited when I watch nursing videos and I hear nurses. I feel what they're saying. I understand 100% what they're going through because I've gone through it myself. I've been in this nursing field for so many years and have experienced so many things and have seen so many things and recognized all types of situations and events that have occurred and continue to occur till this day. So, the first video I watched from her, I don't know her name. I wish I knew her name. But um the first video I watched, she said I quit my first LPN job after 1 day. And when I tell you I felt what she was saying to the T, and here it is. She did this video 2 weeks ago, and I'm like, oh my God, the nursing school thing has not changed. I was just like, wow. But it is what it is. So I just want to get right into clarifying for this beautiful young lady her experiences because they are a constant thing. They are never changing. It's been going on since I went to LPN school back in 1995, 96. So I'm just like, wow, we are in 2024 and nurses are still feeling the same way after nursing school as I myself felt. So let's jump right into this. I feel for this nurse because not having family in the nursing field to enlighten me on things that occur, will occur, have occurred, it made nursing all the more difficult because um, other nurses just are mean. They are just not nice. They're not nice at all. You will come across a nice nurse, um, far few in between, right? And let me tell you the reason why I say this is because the majority of the nurses I have run into or I've worked with, they have just been mean, mean, mean. And then there's your pretend to be nice nurses because they want something from you. And then there are just your nice nurses who are nice because they don't know what they're doing. So they're hiding their a lack of a good foundation behind their niceness, right? And then you have nice nurses. I mean, some of them are just, hey, I know what I'm doing. I'm nice. This is just my personality. I had a wonderful upbringing. I was taught to be respectful and do a good job and, treat people with kindness and respect how I would like to be treated. And so there, there's just this array of nursing personalities out there that makes it difficult to navigate. Now I'll just tell you the type of nurse that I am. I am your mean, competent, nice, with a good foundation, zero tolerance, no nonsense nurse. Right? I help you to the ends of the earth if you need it. If you can get past my meanness, if you can get past, my if you can get past my ability to function independently, right? I'm not to say that I'm not a nurse that doesn't need help, because I need help. I need help all the time. I still need help. But I just find that a lot of nurses are mean. They will recognize that you need help and they won't help you, right? They'll sit back and watch you F up, fall over your feet. You know what I'm saying? Bang your head against the wall trying to figure things out. Not tell you how patients are. Just let you fall into the same traps that they fell into. And I've noticed that, right? And then you just have some nurses that just, I'm just going to tuck and roll, mind my own business. I really ain't got nothing to say. And things of that nature. But anyway, enough about me. I just wanted to explain what type of nurse I am. Let's get into this video because I thought it was very, very interesting at what she was saying. Because, like I said, the nursing field has not changed. So, anyway, let's get started.
Happy Tuesday. Thanks so much for clicking on this video. I'm Aaliyah, and today we're going to talk about how I started my job yesterday and I quit my job today, okay? So make sure you like this video if you like this video. Subscribe if you haven't already, and also comment down below. Let me know your thoughts and opinions. All right, so for y'all that don't know, I recently graduated about 2 weeks ago for my with my LPN, and I also
Well, I just want to say congratulations. That is such a huge accomplishment. I don't care what anybody says about the nursing field, and it is a huge accomplishment. I felt so accomplished and so successful when I graduated my LPN program. It was a big step for me in life. It has ushered me, pushed me, guided me forward to where I am today. I'm so happy that I did it. I'm thankful. And yes, I'm thankful always.
went and took my NCLEX on this past Friday, and I got my unofficial grade or score, whatever, on Sunday, which was a pass. So I'm still waiting to get put on the register and all that good stuff. Started my job yesterday.
Whew.
Okay. Okay.
Okay.
Somebody did ask me for an update, so here's that. Anyway, when I got to work yesterday, I was supposed to work 7 to 7. First of all, I didn't have a schedule or anything. I was just expecting that I was gonna go in and I was gonna get a schedule. I was gonna be able to get logged into the system. I was gonna be able to learn the people. I was gonna be able to maybe pass medicine or something. But last week when I went to orientation, the DON told me that I would have to work days because I have to work with an RN. Now she said I would have to work directly with the RN. And she said once the RN leave at 4 o'clock, then I was gonna have to work with an LPN. But at that time I would not be able to touch anything. I would just be observing for the rest of my shift.
Okay, so what the DON did not tell you is that even though you passed your NCLEX, you have your unofficial results, you don't have the credentials yet. So they can't give you a login. They can't allow you access to the patient information, the medications, and different things of that nature because you are technically not a licensed nurse until your license has been posted. right? So that was one of the things that they should have explained to you better. See, what I have found in nursing is that um, there is such poor communication. People, people really have poor communication skills, and that just should not be when it comes to nurses in the nursing field. This should be one of the most communicative fields in on the entire globe, because you are dealing with people's lives. You are dealing with their medications. You're dealing with their financial business. You're dealing um, with their healthcare business. You're dealing with their family business as well. I mean, you're just dealing with the patient as a whole. And to have poor communication skills is just something that should not be tolerated in the nursing field, right? So when you hire nurses and you are in charge of nurses, your communication skills should be A1. I'm sorry, it is what it is. There's just no fudging on that. A1. There are all different types, there's all different forms of communication. If you are not a verbally communicative person, then you should be a very well written communicative patient. So it's not to say, I mean, nurse, it's not to say that you should, just be a chatty Cathy like me. I'm a chatty Cathy. But if you are in charge of nursing, your nursing staff, you should have developed some way that you can communicate with your nurses so that they're not running around in a daze wondering what the hell is going on, right? So basically how I interpret just her beginning statements is that what the hell is going on? What am I doing here? What am I gonna do here? Who's here to help me? I mean, she just has no direction to go in, and then when she is given a direction to go in, that she's been redirected to what do you call that? A never ending street of questions, right? So I think it was unfair how she was communicated with. It just, I don't know. Me personally, I probably would have left myself, right? Because how things begin is how things are going to end. If they begin with lack of communication, it's going to end with lack of communication. um Believe it or not, people, their feelings get hurt, and I don't want I just I don't want to say feelings, but I want to say they're moved, in a certain way, when they feel like um they aren't heard, they aren't listened to, and then they aren't communicated with. So any slight misstep in communication can send a nurse spiraling into nobody likes me, everybody here is mean, this, that, and the third, and just send the nurse into, oh my God, I hate my job, I hate my life, I hate nursing. Right? We take it to the extremes because of how we were educated in nursing school. Right? I'll go into that because, like she said, how we're educated in nursing school, and when we get out here in the real world, in the field, oh my God, it's like apples and oranges, right? So anyway, let's continue.
I said, okay. So I get to work yesterday and I was not on the schedule. Hmm. So they just put me with somebody which happened to be an LPN. And I said, oh, I thought she said that I would have to work with an RN. He said, we don't have any RNs besides the DON, the ADON. I said, oh, well, she said I can't touch anything with LPN. So I guess,
Well, I'm going to tell you, they couldn't put you on the schedule because technically you're not a part of the nursing staff yet. right? So you're pretty much like a phantom nurse right now, because they can't add you to the schedule and add you in there. Oh my God, what do you call that? I forget what you call it. I'll figure it out later. But they can't add you as one of the nurses on the floor yet. So this is why you pretty much don't have a schedule, because even though you gave them unofficial results of your NCLEX, they still need that license to be posted in order to really to really solidify the deal. So at this point in time, they don't have, it sounds like their orientation process sucks. Their communication sucks. Um, Nobody really, the DON and the ADON, they aren't communicating with one another, because the DON is telling her one thing and the ADON is telling her another thing. And that is how you know there's a breakdown in communication or a lack of communication between the two. Um, they don't have a sound orientation program, and they don't have a sound program for hiring nurses who have just passed their NCLEX and their license hasn't posted. So, yeah, the communication sucks, and she was probably lucky that she did get out of there. What she's going to describe later on in this short video was appalling to me. It showed lack of leadership, it showed lack of care, it showed lack of integrity in the entire building, and it just showed that people are allowed to just come there and get a check and do whatever the hell it is they want to do, and that's not how nursing should be done. Okay.
I'm just going to be observing all day. Well, I was trying to wait for her to get there because I wanted to talk to her to ask her like what was going on, because I was a little confused because what she said last week, and if y'all don't have any, then how is that going to apply? Well, she wasn't there. They told me that she was on vacation, so I said okay, that's great. But it was an ADO in there, and I didn't even know we had an ADO in, to be honest, because I never met one. But I met her yesterday, and I told them like that I passed my test, and I sent them the unofficial results and all that good stuff. And so she was like, "Oh, that's great." She said she was going to send it to the DON and she was going to send it to HR, but she was like, "You still can't touch anything at all." So I said, "Oh, okay." So I'm just working with the guy and we're just talking and stuff, and I'm asking questions, and he seemed to not know a lot of things that I was asking. Now he's been working there for a year and a half. I asked like, okay, if there's an emergency where like a fire or something where we need to evacuate, like, well, how do we do that with the people that's on like special machinery and then
Wow. So a nurse been working there for a year and a half and cannot tell her about emergency preparedness and what do we do in case of an emergency. Wow. Wow. However, that is your maintenance. They're supposed to come out and they're supposed to educate on or in service on fire safety, evacuation. They're supposed to be having mock fire drills, different things of that nature. The guy's been there a year and a half and he doesn't know what the emergency preparedness is. So I would be questioning, does he know what medications he's passing? That would just open like a whole line of questions for me, right? Especially, considering the fact that he is technically orientating this young lady. So he should be able to answer any questions she has or direct her to the appropriate materials to get her questions answered. Now, with that being said, there should be what we call a red book, which is the emergency book. It's supposed to have the emergency plan in there, evacuation plan. It's supposed to have a diagram of the facility with all the exits posted, and you're supposed to know on which hall evacuates out of each door, right? But that's troubling that this nurse couldn't tell her that, which speaks to poor communication. In servicing is communication, education is communication, written materials are education. Um, I mean, what if State would have came in and asked him that question, and what he gonna tell State? I don't know. So, in other words, if an emergency occurs, you don't know how to help people, but I bet you know. I bet he know how to get out the front door himself, right? So it just says that the nurses aren't even prepared. And when I say nurses, I say because if one of them don't know, then that means many of them don't know, and the entire facility might not know, right? So there's lack of communication and education as far as the emergency preparedness plan. Hmm.
And it's a bigger woman in there. So I was asking like, how do y'all kind of get her out the room? Not trying to be funny at all, but just trying to see what's the protocol. He said he didn't know. Okay.
Well, the protocol for getting a big girl out the room, a big woman out the room, it would depend on whether she can ambulate or not. If she can't ambulate and she is bed bound, then she will be one of the last ones to be evacuated. So evacuation goes like this: you grab your ambulatory people, your people that can walk, and you guide them to the exit because they can go in the same direction. Hit this door, right? So there should be someone on each hall evacuating people. So your ambulatory people go first, then your wheelchair people go second, and then your bedbound people go third because they're gonna have to be uh, evacuated in their beds. So that's how it goes. Okay, the nurse should be able to at least say something like that, right? And I don't know how long this male nurse had been a nurse, but it doesn't, I mean, it doesn't take a brain surgeon to remember this if told at least once or twice, right? That's facility to facility. That's hospital, that's nursing home, that's assisted living, that's group home, that's, basically whatever medical facility you're in, right? Ambulatory people go first because they can handle themselves. Wheelchair people have to go next. The ones that can wheel themselves, they can go. The ones that need to be pushed, then here they come. And then the ones in the bed, here they go, right? Now, you do have certain situations where you can't get the bed out of the room. So, what if you can't get the bed out of the room? If you can't get the bed out of the room, then you're going to have to use what I would call the drag method. So, you would have to put a sheet, you'd have to grab the patient with the sheet off the bed to the floor and carry them out. If you can't carry them, you're going to have to scooch them along the floor. Hopefully you're staffed enough to where you don't have too many bedbound people that you have to do that to. So they should basically be able to be handled by maybe 4 staff. But that's where your plan comes in. Now, what's your plan? How are we going to get this large patient out of the facility if the bed doesn't come out of the room? Because a lot of times they need an oversized bed that won't fit through the doors. I've experienced that trying to move beds. Like, oh my God, this bed don't come out. The maintenance people had to turn it on the side to get it in the room, right? They had to turn the mattress on the side and bring it in the room. You can't do that with a patient in the bed. So yeah, we should. I mean, it's something it's a necessary. It's a necessary good, right? So that's kind of concerning that that nurse could not provide that information to this nurse. Now, there is a breakdown in the orientation process, and there has been, from what I can tell, working in different facilities for many, many years. A lot of the important things during orientation they no longer do. As a matter of fact, they even have the audacity to have non medical personnel orientating medical personnel. I know you're in the room and you're just signing paperwork. But when it comes to nursing portions and different things of that nature, you should have a medical professional in there orientating. That is not what's happening in some facilities, and I think it is a horrid way to orientate nursing staff. Anyway, let's continue.
So a lot of things that I was asking, he just simply didn't know. So I was kind of wanting to talk to her so I could say, nobody's knowing anything, But anyway, the scheduling lady came up to me later on that day and she was like, "Hey, can you step away and go do orientation paperwork?" I said, "I did orientation paperwork last week." She said, "Oh, you did?" I said, "Yes, I did all my orientation."
Okay, so the lady telling her to go do orientation paperwork, the schedule telling her to go do orientation paperwork. Wow, where's the communication? And she's already done her orientation paperwork. Like, I don't know what building this is or where this is. I don't. Matter of fact, I don't even want to know. Because I mean, that's horrific. That's horrific that there's no there's just no communication at all whatsoever. I mean, you don't even have a plan for a new orientation paperwork. You don't y'all don't know nothing that's going on with your orientees. They just sending her all over the place and or trying to send her all over the place for nothing because they don't have their ducks in a row. They don't have their shit together. And that is scary. That is scary because when you have that type of thing going on, you're wondering what the fuck are the nurses on the floor doing? Like, what's everybody doing? When you see a breakdown in a system or a system that is in disarray, you got to wonder about all the systems that are going on and what's going on in this building. But okay, I guess that's just me.
orientation paperwork last week at orientation. She was like, "Oh, okay." So she said, "Well, what's your schedule?" I said, "I don't have one." She was like, "Oh,
So she the scheduling lady. She's a scheduling lady and she's asking the nurse what her schedule is. So that means they're telling the DON is telling her you're gonna work this day, that day, and that day, but she haven't told the scheduler her plans for this nurse yet. And this scheduler is running around not knowing what to do with her new staff that she needs to schedule. Obviously, they hired her because they need nurses. So what were you hiring for? What position and days and times were you hiring for? I mean, wow. Wow. I quit my first LPN job after one day. Okay.
oh yeah, okay." So she's the scheduling lady. She wanted me to go in her office and so that we can talk about me a schedule. So I said, "Okay." I went and did that. I went and talked to her, and she was like, "How's every Monday, Friday, and every other weekend?" I was basically like, "You know what it is, what it is." And I said, "Well, will I work with the same nurse or would I work with different nurses?" And she said, "What do you mean?" I said, "Well, am I going to work with the same nurse like every day, or do I work with like a different nurse on the weekends, or how does that work?" She was like, "Oh, well, I was going to let you work with somebody tomorrow, and then I was going to put you by yourself on Friday." And I said, "Did they not tell you that I just graduated 2 weeks ago?" She said, "Oh, well, yeah." But I said, "Well, how much training do I get?" I said, "Because I haven't even touched anything. For one, I'm not logged in. I don't have a login. Like, I haven't done anything." And she was like, "We'll ask the DON tomorrow." So she scheduled me to work today so that we could talk to the DON this morning. Well, when I got here today, they said the DON was on vacation. And then, of course, state came in the building. Hmm. So, that was kind of pretty much put on pause. The DON came in, the ADON, and everybody else came in, and so I was trying to talk to her, but she was busy with state, so I was just talking to the lady that I was like with, and I was telling her, I was like, "I'm not understanding how is it that I'm training, but I'm not doing anything. Like, I'm not being able to do a med pass because I figured that they will be able to watch me do a med pass and talk me through it and stuff, and like talk me through taking."
Okay, so if you do not have your license posted. It means you are not a licensed nurse yet. You're a nurse pending licensure. So you can't pass any meds. You can't touch any meds. You are an unlicensed, right now you're considered as an unlicensed personnel. So you can't touch meds.
Heard these people are doing.
You can't pass meds. You can only observe, right? So this is an observation period for you. So but nobody is clarifying that with this young lady. Nobody's clarifying it with her. They don't know what they're doing. They have no direction. They're putting people in the position because they're likable, or their family, or their friends, or they were referred, or you know, I don't know what it is. They're cute. They look good. I don't know. They got a nice shape. They look good in uniform. They got a pretty face. I don't know what it is, but it ain't because they know what they're doing, right? It's just it's yeah. There's a breakdown in the nursing system.
For my job basically through the system and whatever else. It may take me a while, but we got 12 hours, baby. We can figure it out. I was told not to touch anything. So later on, probably around 11, 12 ish, the schedule lady came back. I guess things died down a little bit. She came back and she said, um, hey, you working tomorrow? And I was like, I don't know. I don't have a schedule. She was like, no, I'm telling you. And I was like, oh, well, okay. She was like, well, I figured you could work tomorrow. You could be off on Thursday, and then you could just work on Friday. And then, yeah. And I was like, okay. She was basically saying my last day of training will be tomorrow. And I'm looking and I'm like, wait a minute. I said, I can't work by myself on Friday. She said, and then she started talking to the other nurse, asking the other nurse how much time did she have to how much time did she have like in training before she started working? She was like, I don't know. That was 15 years ago when I graduated. We was doing a program thing because they was trying to see if they was going to let LPNs back in the hospital. So we was doing like a trial thing, and we were able to work like early and all that stuff. So she was like, so when I got done with school, I only had to train for a week because I got a lot of training done before I graduated. This lady said, oh, okay, so a week. Okay, I figured that. So yeah, I'm gonna put you on tomorrow, and then on Friday I'm gonna have you by yourself. And I got tired of explaining to the lady, so I just said, okay. And then so she left. I told the nurse, I said, I'm not gonna be here tomorrow.
Well, see this this is the thing, right? Um, this is what this is saying. This is saying that we have a nurse that just graduated nursing school, took her NCLEX right away, and passed, doesn't have any hands-on experience in the field, let alone by herself in the field. But yet and still, we are going to allow her to have keys to a medication cart, keys to a narcotics, a nar- keys to narcotics, keys to med rooms, and access to our patients, right? So basically, what we're saying is that we are going to release this nurse on our patients, and she does not know what she's doing. She doesn't know the system. She doesn't know the patients. She doesn't know the med pass. She doesn't know pretty much how things go through during the day because she hasn't had a sound day of orientation. It doesn't seem like she was able to observe a med pass. I don't know what is going on, but if they, right now, she's an unsafe nurse. No fault of her own, just because she has no experience and she is new to the field and she has not had a proper orientation. Right now, I would consider this young lady to be an unsafe nurse. So, the goal for orientation is to ensure that we are putting safe nurses on the floor, right? You got to be safe. It has to be a safe nurse. Nobody said she had to act, she had to function like the bionic woman. Nobody said she had to be Supergirl. Nobody said she had to be Wonder Woman. None of those things. It just says that she needs to be able to function safely. And in order to do that, she needs education, orientation, and a good direction to go in order to be successful. So right now what's happened is that they were setting this young lady up for failure. I don't know if they it sounds to me as if they didn't want to hire her, but they hired her anyway. It sounds as if, they weren't giving her clear cut education, instructions, directions, because they really, maybe they didn't have any room for her, or maybe they didn't have any plans for her. I don't know. Maybe the plans for her changed. Who knows? But they were going to put an unsafe nurse out on the floor to care for patients, pass medications to patients, have to communicate with doctors, have to take orders, have to communicate with family members, and things of that nature, have to do an array of nursing skills that she has yet to um, even, I don't even want to say master, I want to say be introduced to. Where's my phone? Oh. Um, Hold on, you guys. Okay, I do. I do apologize. So let's get back. Wow, we're gonna have to. You guys are gonna just have to skip. Like I think what 10. Let me see how many minutes y'all gonna have to skip on that one. I'm so sorry. I'm so sorry, but I had to take this phone call. So 22 minutes. Oh my God, that's a long time. Okay, anyway, but let's continue with what this beautiful young lady is saying.
I'm not coming back. I said when I leave her, that's it. So I'm just sitting there through the day, and then I'm just getting frustrated because I'm like, I'm not learning nothing. She trying to force me. I don't have a login. I can't see anything about these patients. I can't do anything. Like I haven't seen anything. I haven't seen a book. I haven't seen any paperwork. They said the books were outdated. Like everything was just a mess. The nurses were talking and they were talking about how they have each other's back up in there, and yeah, if you want to go take a 2 hour nap, I got your back. You know, you just come in before med pass and this and that and all this other stuff. And I'm just like,
So you see how that there's a lack of integrity. I always say, to nurses, bring your integrity with you, because a lot of these facilities, they are just riddled with no integrity. Everybody, like I said, everybody's in these facilities and they're doing whatever they want to do. I don't know if it's because that's how they're retaining their staff. I don't know if that's how they keep staff complaints down, or if they keep staff happy to keep them there. But you try to go take a 2 hour break while I'm there, and it's just not going to happen. There's going to be consequences. But then again, you have to tread lightly, because if the nurse is going to take a 2 hour break, then that means um, the nurse can go take 2 hour breaks and not and has no fear of consequences, repercussions, or accountability, right? So there's something there that you might not want to touch upon. You know how you shake a tree and a bunch of bees start flying out? You might not want to touch on that. So if the nurses are all together on the same page and they're doing things that they aren't supposed to be doing, and you come in like me and you beg to differ, then you're pretty much ostracized, talked about. um your character is defamated, and nobody wants you around because you're the one that's stopping them from doing all of these things that they shouldn't be doing. Passing the wrong meds, not treating the patients right, not doing their job in a timely manner, and different things of that nature. So it's just pretty much, the devil's children are out to play. And when you come in as God's child and you don't want to play with the devil's children, and you don't want to play the devil's children's games, they don't want you around because you don't fit this devil lifestyle, or you don't fit the devil, the way the devil is doing things in the building. So I think it was best that this young lady did exit stage left, because she would have put herself, her license at risk, and she would have put patients at risk, and she could have potentially put other nurses at risk. So yeah, I think it was, as a new nurse, not knowing anything, not being orientated properly, she would have probably made some mistakes that nobody would want to make.
so I'm just sitting there and I'm like, you know what? I think I want to go. I was just talking to her because she was actually cool. She was talking to me and stuff, but she was like, yeah, you should probably go to the hospital. You get a lot of experience and stuff. But I was just like, you know what? I think I want to go. I was like, I don't want to wait till 7 o'clock. I said, I haven't taken a report. I haven't gotten any keys. I'm not abandoning anybody and anything like that. She was like, okay, well, you could just go clock out because I was looking for the DON, but I guess she was still busy. She was like, well, you could just go and clock out and I'll just let her know you had a family emergency. And I said, okay. So like 2, 3 hours later, the DON texted me and she was like, hey, you had a family emergency. I hope everything's okay. I was just trying to see when you was coming back. I called her and I was like, I don't think I'm coming back. I think I'm quitting. She was like, well, what's wrong basically? And I was like, they're trying to rush me to train. I said, you told me that I had to work with an RN, but they said there's no RNs in the building. She said, yeah, it is RNs. It's me, the ADON, and there's another person. I never met the actual other RN, but how is it that you saying there's an RN, but everybody else, all the other nurses and stuff are telling me there's not? So I was like, I haven't seen any. She said, well, you're supposed to work. She said, you can do stuff as long as an RN in the building. And I said, well, last week you said I had to work directly with an RN. And yesterday it was an RN in the building, the ADON, and she stopped me specifically and said not to touch anything. And she said, well, it was a miscommunication. And the DON,
No, there wasn't a miscommunication. There is no communication. There's no plan for young nurses in her situation who probably just have an interim permit. So everybody is playing. Um, I don't know what game they're playing, but they're playing the, oh no, we've communicated, but there was just a miscommunication. If you've communicated, there shouldn't be a miscommunication because there are steps in communication. So if you didn't follow each step in communication, and the final step, which is clarity, right, and define roles, and define practices, you there should not be any miscommunication. So the biggest problem right now that we're having, or one of the biggest problems that we're having, is lack of communication. Everybody's doing their own thing. They're not collaborating. I don't know what their meetings are, what they're doing in their meetings. I don't know. No, there's just uh, the things that should be happening just aren't happening, and you know, we it opens the door to question why. This is 2 weeks ago. She did this video 2 weeks ago. So I'm kind of wondering, like, in this day and age and time and the way things are, we're in the nursing field and we're not communicating well with one another. We don't have sound plans for different functionalities within these facilities. Like, what the fuck is going on? Like, what? Like, really? Like, what's going on here?
it was like, well, you need to really do like at least 3 shifts on each hall and do all the med pass.
So she's telling her, "Oh, you need to do at least 3 shifts on each hall and do the med pass," but none of that was planned out. When did she come up with this plan? Like, with that was that if that was the plan, and if that's what she needed to do, then that's what she should have already been scheduled to do. So why does it take a person saying, I no longer want to work here, for them to all of a sudden pull a plan out their ass and say, oh, well, this is what you need to do. This nurse wasn't heard. She wasn't listened to. And, she was going to be put into a very, very dangerous situation. So how is that nursing again? It's not. I don't know. I don't know what's going on.
And stuff like that so you can get comfortable. And if you're not comfortable after that, then we'll go ahead and, give you more time and stuff like that. And I was like, okay, cool. So she wanted me to come in tomorrow 7 to 7, and it sounded good. But then I was just like, I'm not gonna do that because I feel like certain things should have been in place already. Like
Mm-hmm.
I shouldn't have to come to you when things go like that. Like first of all, y'all employees are doing whatever they want to do. They talking about they taking naps and they going home, going to sleep, going to grocery store, all this other stuff on the clock. I didn't tell her all that, but I was just thinking. And I was just like, y'all employees are doing whatever they want. Y'all are not even there on the weekends, so I can't do nothing on the weekends if that's the case because it's no oriented in the building on the weekends. And then I was just like, thinking like this is not the place for me. Like it's 4 minutes around the house. They started me off at $29 an hour, 312s a week, and all this stuff. And I was just like, this is just not for me because like it shouldn't be at this point. Like I should have a login by now. I should know how to get into certain things. Like I should at least kind of know. Like I should have been working on like med passes and stuff. It shouldn't be miscommunication where the ADON tell me not to do nothing. Like the scheduler shouldn't be trying to force me to go and work because I felt like in my heart that if I would have went to work on Friday and actually worked as an LPN, nobody would have said anything. That's what I feel like. Nobody would have said anything. They so short staffed and stuff, and I just felt like it was just gonna do whatever it was gonna do. But anyway, needless to say, I quit. My phone is about to.
But that's what they're doing. That's what they're doing in these skilled nursing facilities. They're bringing these nurses in, and um, they're bringing the nurses in. They aren't training them properly. They're new nurses, and they're just throwing them on the floor and don't give a damn what they do. And they don't give a damn what they do. They're, I guess it's called find your ass, right? Find your ass. Go ahead and do what it do. Learn the system on your own if you feel safe to do so. And we ain't gonna say nothing. We gonna turn a blind eye to whatever it is you're doing. You know, who cares if you don't have any MedPass experience? MedPass is very serious because there's things that go along with it: blood pressure, pulse, respirations, vital signs, different things of that nature. So, if this nurse hasn't even seen an example of a safe nurse, then how does she know whether she's being a safe nurse? And yes, she was supposed to have learned things in nursing school. However, it's totally different when you get out here in the field. So, when you're in nursing school and you're doing clinicals, you have your teacher to go to. And your teacher is saying, "Hey, whoa, whoa, hey, wait a minute, y'all, right now, y'all under my license. So, you ain't about to do nothing unless you get it approved by me. Don't pass now. If you're gonna pass meds, you come to me, and we're gonna make sure that these are the correct meds that you're passing. We're gonna make sure that there's if labs needed to be checked, we're gonna make sure these labs have been checked before we administer this medication. If you got insulin to give, we want to make sure that we see food on the floor before we give this insulin. If you got blood pressure medications to give, we want to make sure that we're taking this blood pressure at the time that we're administering this medication and we're getting accurate results. We want to make sure if we're giving digoxin, we're taking the apical pulse. I need to make sure that you're doing what it is you're supposed to be doing every step of the way before you pop any type of pill in anybody's mouth. I don't give a damn if it's a vitamin. Is it the right time to be giving this vitamin? Right? I don't care if it's a stool softener. Is the stool softener due at this time? We don't care. We need to be practicing safely. So when you get out here in the nursing field, in the real world, there is nobody to go to like that. Or not say go to, but there is nobody that's riding your back like that. So the nursing supervisor is not going to say, "Oh, hey, ho, wait a minute, hold up, you're a new nurse. I want to make sure you know." The reason it's different is because now you have a full med pass, maybe 16 to 20 people. In nursing school, we're just passing medications to one patient. And so the instructor is just checking us off and for that one patient, right? But it's different when you got 17 to 20 patients to pass meds for. You have to be safe with each one of those patients and their medications, and do what you're supposed to do before you administer that medication. So if you're gonna administer Lasix, you want to go and make sure you see what the potassium level is. If you're going to administer potassium, you want to go see what the most recent potassium level is. If you're going to give Coumadin, you want to know what the most recent INR is. That patient could have had an INR done today. Nobody called it in. Nobody changed the orders, and that patient's INR could be 4 or 5 something. And you're going to give Coumadin, and you ain't checked the most recent INR results or to see if they need an INR. The patient probably didn't even have the INR drawn because somebody forgot to put the lab rec in or call the lab into the lab, right? So it's different when you're in nursing school. You got one patient you're passing meds to, and then when you get in the real world, you got 20. And the nursing supervisor is not going to be like, wait, you're a new nurse. I need to make sure that you're safe passing med. She's not going to go on your full med pass with you, which what she needs to do or what needs to be done. You need to see a full med pass to see how that nurse functions. But then again, the nurses aren't even functioning properly, so you're still not going to get a proper med pass orientation because they're just doing whatever it is they think they should be doing because they didn't get a proper orientation. So it's just like, one, two, three, four, five, six, seven. Everybody got orientated the same way. So now you got seven basically half cocked nurses on the floor taking care of people. And then when you have a nurse on the floor that doesn't even know the emergency preparedness plan, that is a telltale sign that your management staff needs to go, and you need to hire management staff that know what the hell they're doing and that give a damn. That and it's funny because you don't. Well, it's not funny, but you don't have to be doing the wrong thing to make your money. I don't know why the nursing field feels as if they gotta, do all these terrible things just to make money. You can do good and make the same amount of money you do doing bad. So why is it so acceptable and so much fun to do bad and make money when you can do good and make money? So that sometimes that's like my number one question. And then you have nurses like this young nurse here who's craving the knowledge, who wants to be educated, who wants to learn. And then you have the nurse that's, oh no, I've been to nursing school already. I know I can do it. I know how to do this. I know how to do, and don't know how to do shit. And be done went and passed the wrong meds, right? Or be done went and did something that she wasn't supposed to do. So at the end of the day, it's just like, can we at least make sure that these nurses get a proper orientation to establish a baseline for the direction that they need to be taken in, the type of education that they need, the type of in services that they need? I mean, why is it so damn hard to do the job? A lot of times the orientation process will tell you if the nurse is going to stay or not. A lot of nurses will be like, that orientation was terrible. But you know what? I'm going to just stay here till I find me another job. I'm about to go and put me in some applications. And then they leave after 2 weeks. They leave after a month. They leave after 3 months. And they have the audacity to be saying, oh, well, no, I don't know why she quit. Yeah. And yeah, and this is the truth. You don't know why she quit because your management staff don't know what they're doing in the first doggone place, right? So like I continue to say, that's whoever your director of nursing is. When you're getting interviewed in these jobs by these DONs, you can pretty much tell where their minds are at when they interview you. When they asking you, and I think this is a stupid ass question. So tell me something. So tell us. So tell me about yourself. I did in my resume. My resume told you about me. My resume told you how long I've stayed on the longest job. It tells you how many nursing facilities I've worked in. It tells you what my degree level is. It tells you what school I went to. It even tells you where I live, right? Um, my birth date tells you how old I am. My resume tells you how long I've been in the nursing field. Um, my resume tells you the positions I've held. So what the fuck more do you need to know? What the fuck more do you need to know? You want to know my pants, my dress size? You want to know my weight? What more do you need to know? Were you that lazy that you couldn't read my resume and see what type of nurse you're dealing with. It's a lot of information on these resumes. You don't know how to decipher who I am by my resume. See, it's these interviews sometimes be bullshit. I like I be preparing for an interview, right? So say for example, if I'm interviewing for a charge nurse position, you know the kind of research I be doing. I be doing research like what is I be doing research sometimes on tags, state tags. I be doing research on nursing stuff. I do research according to the position that I'm interviewing for, that I've applied for. And do you not know I never get asked a damn question regarding the regarding the position that I'm applying for? So, I mean, I be thinking like, well, what do you mean? Tell you a little bit about myself. A lot of these interviews are behavior based. They want to know how you're going to behave. I sometimes I had a couple of interviews, recently, and the questions that were asked, it was tell me something about yourself, and that was fine. But then the follow-up questions to that were like, what would you do in this situation, and what would you do in that situation, which is behavioral. Like, they want to know how you're going to behave in the situation. And I thought the questions were very good. They were very professional. They told you how I would behave, but they also told you my knowledge base as far as the question and the situation, right? So, I mean, a lot of times they're just looking for a warm body. And they thought that this young nurse right here, they thought she was going to be just a warm body. We just need a warm body to fill the schedule, right? You just leave them alone while they're on the floor and let them, you know, do what they do. We're not going to give them no direction. We just going to focus on our job and what it is we need to do. But the nurses on the floor, they are your job. The CNAs on the floor are your job. So it's almost as if there has been, how do I want to put this? There has been a gap, a huge gap, or let's say a line. There's been a line drawn that the DON, the staff developer, and the ADON don't want to cross. And that line is their office and the nursing floor. They don't want to cross that line over into the nursing floor. But that line shouldn't be there, because that nursing floor, it's a part of their job. And so I don't know if they don't like going swimming over there in the nursing in the nursing area, but sometimes you got to put your swim shorts on, and you got to go in there, and you got to swim with them, see what they're doing, give them some guidance, give them some direction, see what you need to be educating on, see what the hell's going on with the patients, right? And that's not what's happening. And this is why these nursing facilities are in such disarray. And then when you have people that come in that are on the floor, that their place to be is on the floor, and when they try to bring some clarity, cohesiveness, and some competence to the people on the floor, it's almost like nobody wants that. Nobody wants to learn the job and do the job the way it's supposed to be done. They want to do whatever the hell it is they want to do, and that's what they're allowed to do. And this is why we're having the issues that we're having. This is why you have a nursing shortage in these nursing facilities, because there is no accountability. There is no, and there shouldn't even be any accountability if the nurses are doing what they're supposed to be doing. So I've come across so many nurses that be like, "Oh no, oh no, I no, I can't do it." I mean, they'll be like, look at this, or look at that, or this is going on and that's going on, and how come I got in trouble for this, but she did the same thing and she didn't get in trouble? How come, and it be some good nurses that are run away from these nursing facilities, people that want to do the right thing, people that that want to see the patients have good outcomes. They want to give quality nursing care. But when you're in a facility and you got 99.999% of everybody not giving quality care, your little 1% is drowned out. Nobody sees it, nobody cares about it, nobody wants to see it. And when they do see it, they're mad because you don't act like them, because you're not going to take a 2 hour break, because you're not going to the grocery store on the clock, because you know you're not doing all the things that they're doing, so they don't consider you to be one of them. But it's like, no, I'm going to do what I'm supposed to do as a nurse. And if you're not doing what you're supposed to do as a nurse, and you're not one of us, you're not a nurse. I don't know what you are, but you're not a nurse. So, no, you're not one of us. It's not, I'm not one of you. You're not one of us. And that's a real nurse doing the job the real way and the way it's supposed to be done, doing the best she can, asking questions, being safe, being able to educate her patients, being able to tell them about their medications, being able to, um, you know, communicate well with their patients and with other people. And so I used to think it was me with the communication problem. And I'm like, no, I don't have a communication problem. These other people have communication problems. I communicate very well. I'm not afraid to communicate, right? But, people will have you thinking that you have a doggone problem, and you don't have no problem. It's them that have the problem. So anyway, I enjoyed that one, and I guess we can all understand um, why she quit her nursing job, and she was right to do so. But she got another video here that I want to go through really quick, and then I gotta go. I didn't intend on to be on here that long, but there's another video that she did that I wanted to review, and so I will just go ahead and share it. Where is it? Okay. So in this one, I'll just let you guys see the title. She says, I regret going to nursing school because. And so let's see why she regretted going to nursing school. And this is, I mean, I agree with her 100%. Like I said, I kind of, you know, hit on some points from this video, you know, during my talk. But we just gonna listen to her and see what she say, and then maybe I'll have something different to say.
On this video. I'm Aaliyah, and today we're just going to talk about the things that I wasn't expecting,
Oh, so her name is Aaliyah. Okay, beautiful.
like the bad things that I wasn't expecting about nursing school. So make sure you like this video if you like this video, subscribe if you haven't already, and also comment down below and let me know how you're doing. Right? Right. So first things first, um, I understand that everybody have a different experience in school. I understand that nursing school is not easy, nor is it supposed to be easy. Um, and I do understand that it depends on what school you're going to and all that good stuff. But as for me and my experience, I wasn't expecting some of the things that were happening to actually happen. And honestly, when I was talking to some people about it, it was like they was like kind of brushing it off, like people that are already nurses and have been gone, like have been through nursing school and all that other stuff. Um, yeah, they were like brushing it off, like, oh yeah, that's normal. Oh, that's nursing school. Oh yeah, this and that, you know. But I was like, well, if
No, but really it is. No, but really it is because those nurses have gone through the nursing school and got out in the nursing field, and they have heard so many of the same stories, same situations, same reactions, and we're like, yeah, that's nursing school. So when you say to me, "Oh my god, nursing school is was so much different than the real world." Like when the way they showed us and trained us in nursing school, when I got out in the field, I saw nobody doing it the way we learned it in nursing school. And it's like, oh yeah, I know. Yeah, that's nursing school. The reason being is because they're giving you in nursing school, they're giving you the foundation. And so we all know that you get out of whatever you're doing what you put into it. So if you put in A1 studying, you're pretty much going to get A's and B's, right? If you put in, like me, I pretty much, when I was in LP in school, I pretty much did A's and B's. I graduated with a B. I graduated with a B. And so we did study groups. We did all kinds of things. We once we graduated a level, because we had 5 levels. Once we graduated a level, we all went out and party. We had a lot of support. We supported each other, through nursing school. So if you guys support each other through nursing school, you're gonna have a good time. You're gonna do well. You're gonna learn, but when you get out in the field, it's still not going to make a difference because the way things are done in the real world, you have, so like I said, you have so many different types of nurses. You have nurses that have been nurses for 1 year, 2 year, 3 year, all the way up to 40 years. Some nurses got 40 years in the game. Okay. Um, a lot of times your older nurses. So say for example, when I run into nurses that are my age, we and or not so much my age, but having the lengthy nursing experience that I have, where we come from an era where okay, nursing school was one thing and the real world is another thing, but we had leaders that said, no, you're still going to do it the right way. No, you're still gonna. And I think the difference is that we were paperwork. We everything we did was on paper. MedPass was on paper. Care plans was on paper. Doctor's orders were on papers. Therapy notes were on paper. Social worker notes were on paper. So everybody had to touch the chart, and you'd be like, "Where's the chart? Who got the chart for so and such? Who got the chart for so and such?" Right? And you can't help but go through the chart. So when you're somebody's asking you a question about a patient and you got the chart right in front of you, it's so easy to just flip to the med section and be like, okay, well, yeah, this patient is on this, that, and the next. And then it's like, oh, you want to know how their therapy is doing? Okay, you go to physical therapy. You say, okay, well, yeah, therapy says right here that she's doing excellent, fine, whatever. And then, occupational therapy. Okay, you go to the OT, speech. If they got any speech, oh, well, she's not in speech. There's no speech notes, and I don't see an order for any speech. The consents are there. Oh yeah, these consents are here, everything is here. There were just the care plan. You flip to the care plan, everything is just there at your fingertips. Now we are in a computer and we're trying to find, okay, where do we find this, where do we find that, what do we do with this, what do we do with that? um it's sometimes it's like when you have to look at a MAR, there's so many different EMAR systems. You got to pass meds, you just grab your med book and you hit the road, you hit the floor. and you flip page one. This is your, your patient. You at the room. You go to the next room. You flip to that patient's mark. Everything is like at your fingertips. Now everything is in a computer, and the computer is turning red. It's turning green. It's turning yellow. You can't see the med until it turns yellow, and somebody didn't sign for their meds on the previous shift, so it's popping up on your shift as red. You might have a medication that was due at 6 p.m. The shift is 6 to 6 a.m. and 6 p.m. to 6 a.m., or 6 a.m. to 6 p.m. If the person didn't pass their 6 a.m. meds, it's red and it's on your MAR because you come in at 6. So technically, you can give it, but at 6, you're in report. You're supposed to have an hour before and an hour up to an hour after to pass your meds. It's 6 p.m. The night nurse didn't, or the day nurse didn't pass her 6 p.m. meds that she was supposed to pass at 5. And it's a hot mess now. Whereas you can just grab your book and be like, okay, well, she didn't sign for. I see she didn't sign for her 7 a.m. med, but that ain't got. It's not affecting me seeing my meds that I need to pass. So I mean, it's so different because it's things are no longer on paper, right? So that's one of the changes in nursing that it wasn't hard for me to transition to, because the EMR system that I learned, I think it was the first EMR system that I learned. Oh my God. Oh my God, why did this facility give us such a fabulous um, orientation to this computer system? By the time they got done with us, I was so confident in this system that I had no issues at all whatsoever. And moving forward to, oh shoot, I want to say, I don't know, maybe 12 years later, that same EMR system a lot of facilities use, when I see it, I get so happy and I see so many new additions to it. I mean, it's just things have just changed. But the ones that should be having the hardest time are the ones who were doing nursing when it was paper. We should be having the toughest time. We should be the ones whose integrity is in question. We should be the ones, because we had to make a transition from paper to computers. And the nurses nowadays, they're starting out with the computers. So, but it's the total opposite, right? We are the nurse, and I think it's because it's because, look, the supervisor or whoever it is that's reviewing the Mars for completion, all they have to do is take that book and take it to their office, or they can stand there with the book and they can say, "Oh, you didn't sign for this one, you didn't sign for that one, you didn't sign for that one," right? And it was like, it just, something seemed different about being able to do that, right? So now you have to go in the computer, and now you have to click on each person to see if their meds were not signed for, or if something wasn't done. So it's just it's totally different, but it's the same. It's the same, girlfriend. Nursing school is one thing, and the real world is a totally different, other different thing. So what you have to do is, I don't know, if I was a teacher in a nursing school, I don't know, I would probably just be really, I'm not going to say, hey, we're giving you the foundation, but when you get out into real world, it's going to be X, Y, and Z. I would never tell a nurse that, because that would scare them out of nursing school. And nursing schools, they want their money. They want their money. But I would tell the nurses, I would just educate them in a way to where they would be able to function in the real world, right? So that's what we have to do. It's amazing that it has not changed. That you still have nurses coming out of nursing school in 2024 saying, "Oh my God, The real world is nothing like nursing school. How do we still have nurses saying that? Like, that means that nobody's listening to us and we're not being heard. But okay.
That's the case. Like somebody should have told me something, because it was a complete shock, and it kind of made me rethink um
Yep.
my decision, even though I continued to go with it. And honestly, if it wasn't so many different opportunities for LPNs and I need to upgrade my life for my kids and all that good stuff, if it wasn't so many different opportunities and stuff, like I probably would have changed my mind after these things. Now,
Hmm.
my school was pretty much
So we had, I think we started with 20 students in my LPN class, and I think we graduated with 15. Yeah, we graduated with 15. I think five people, like one girl, she was like, I'm about to drop this and go to school for X-ray tech. She went to school for X-ray tech. We had another another nurse. I can't. I just remember the X-ray tech because she was just so specific about why she was leaving. But anyway, even after we all graduated, we kind of, I don't want to say, we kind of kept in touch, right? You keep in touch with specific people that you got along really well in nursing school. So one girl, she graduated, she passed her boards, and she went back to waitressing. Go figure. She went back to waitressing. We had one lady that graduated. I'll never forget her because we got along so well. She graduated and she went straight into utilization management because she had a friend that did utilization management, and her friend was able to get her hired where she was, right? A lot of times it's not what you know, it's who you know. And that's sometimes that could be one of the problems, right? It should be what you know and not who you know. And if you know somebody, it still should be what you know, even though you know somebody. Because I think that's one of the worst ways to get a job, just because you know somebody but you don't actually know the job. And then with the way that they are orientating people and educating people, which is nothing, it just makes for a bad situation. You got to find your ass. You're making a lot of errors. You're just pretty much uh, grooving into a system where you're not going to be held accountable for anything because it's who you know. So anyway.
unorganized. And when I first heard about the school that I actually decided to go to, like it was really good. Like they were giving, people were like, "Oh yeah, that's a really good school and stuff." Now I know everybody have their hard times and their downfalls and things like that, and I guess I just caught them at a really really bad time. But the experience was kind of wild. We started with like 50 some people in our class, and we graduated. I think it was.
Now, I don't know, me personally, I don't know how 50 something people are going to be educated by one teacher. I mean, I guess they signed so many people up for the program with the anticipation that they drop out or they don't last, or and then that's just that it's a given. You're gonna have so many people sign up and say, "Oh yeah, this is what I want to do in my life. I'm gonna be making so much money. I'm gonna be doing this," until they have to deal with vomit, or till they have to deal with feces, or till they have to deal with blood, and it's like, oh God, I can't do it. They drop out, or till you have to really put in the work and study. Some people don't have the stamina, some people don't have the endurance, some people don't have the longevity, so they drop out. Some people, their self-esteem makes them drop out. They don't think they can do it. Somebody gassed them up and said, "Oh, you can go to nursing school, you can do it, you can do it, you can do it," and then when they get there, it's like, "Oh, I can't do it." They drop out. Then you got other people that drop out because they done told somebody what they doing and say, "Oh, you doing that? Mm-mm, I done heard so many bad things," so they drop out. Then you have, people that just can't get with the work, can't pass the test, can't understand, can't retain the information, and then they drop out. And then you got some people that just really didn't take the program serious. They thought it was going to be a walk in the park or a piece of cake, so they drop out. So I mean, it's anticipated. You Everybody can learn, but it's just all in who you are and what you can do and how what you think your success level is going to be. So they will sign up a lot of people, and with the anticipation that you're going to drop out. And that's exactly what happens. And that's what happened to us.
It was 24 of us that actually graduated, which isn't horrible because it's about half. But we had a lot of different teachers coming in, and it was that we had a lot of, like I said, different teachers. So it wasn't any structure. It seemed like, and when I was coming in, the director of the program was actually retiring, and so we got a new one. And let's just say, I understand people go through personal things, but they say leave your personal situations at home. We had situations.
And that is what I say all the time. Leave your baggage and all your personal things at home because it affects your job. Leave it at home because it affects your schooling. If you want to be successful, you have to learn how to separate the two. If you don't know how to separate the two, if you don't know how to separate your emotions from the job, your emotions will overtake you and you will lose pertinent important staff, right? Your emotions have taken over you. You're feeling some type of way, right? You're not thinking straight, and you X out people that really had your back, and you end up with a bunch of people that really don't. Same thing in nursing school. You bring your baggage to school, you distract other people, you discourage other people. Nobody wants to really hear that shit unless they some gossipy Susans, um, the people that can't mind their own business and love to hear bad things about you and other people. You got them kind of people, but yet they still know how to listen to it and then move it to the side and focus on what they need to focus on. But here you are bringing all your emotional baggage everywhere you go, and it's distracting you from accomplishing your goals. Separate that shit. X people out when you're trying to accomplish something who mean you no good. But when you're emotional and you're bringing personal issues into places that they don't need to be, you eventually fuck up.
Where teachers came in and um, they were going through certain things at home, marriage problems, mental problems, health problems, and all that. And they kind of were taking it out on us in a way, like they were just coming in having a bad day. Now, my class where it was kind of annoying at times, but my class always liked to laugh. My class always liked to find the fun parts because it was so stressful. We don't want to sit here and just be stressful because the program itself is stressful in general, in which I knew that part because you're going to school to do things like this is serious. So of course it's going to be stressful as well. But it was some. We had a lot of problems with teachers coming in and out. We had problems with, like I said, teachers coming in with problems that they had at home and they taking it out on everybody else because people are smiling because people are in a good mood or whatever the case may
Hmm.
be. It was so unorganized. We had teachers that were going behind, um, like the deans or whatever her name is, well, whatever her position is, the director. They were going behind her back. They were skipping clinicals, asking students to lie. They were skipping, doing open book tests when it wasn't supposed to happen, and all that other stuff. Adding extra points for some people, like it was just a mess.
Wow. Wow. So we got that going on. So we got that going on. This no comment. Mm.
And to be honest, that's not really the part that really threw me off. The part that actually really had me questioning things in general, was the clinical experience. It was mainly the clinical experience. Now, we have had, I didn't get much out of my clinicals. I'm not even gonna sit here and tell you guys a lie. And
Mm,
that's why I try to express to people, like, especially when I go to jobs, I need you to show me and tell me as if I'm just, I haven't heard anything else. Like,
mhm.
there's things that I know, but it's things that I haven't actually done. Like, I know the book way, but I haven't actually put my hands on those, because some of these clinicals, most of these clinicals, we have had the problem where um, nurses are freaking mean, apparently.
Mhm.
And I didn't know that, and it made me not even want to be a
Mhm.
part of the team. I'm not even gonna lie to you, that's just real and that's just wrong. I'm not gonna say all of them. It was about two clinical sites that I went to, two out of all the ones that I did, that they were welcoming, they were willing to help, they were nice, they were understanding, and yeah, because they felt like, one lady.
Well, let me say this. When I was in LPN school, and when we went to clinicals, our instructors had the list of patients that we were going to be caring for. And so this is how it went for us at clinicals. At every clinical, I mean, this school, listen, hey, I know how to pick them. My LPN school, my RN school, fabulous. Now, this is how our clinicals went. Our teachers, our instructors had a list of patients, and she assigned us to a patient. Now, this didn't interfere with the nurse. Now, the only thing that would take place that had to be done pretty much in a timely manner was passing giving the patient their medications. So what we would do is we get there at 6 a.m. I think it was 6 a.m. or 6:30. It was so many years ago, I really don't remember, but I know we got there well before the 9 a.m. med pass. And so this is what we had to do when we first got to clinicals. First, we get there at 6. First, we meet up. She would tell us, this is what we're going to do for the day. Um, this is what my requirements are. You don't do this unless you come to me. They had everything spelled out. You don't touch a patient, you don't give a med, you don't do anything without my approval. If a nurse was telling you to go do something for her, you can't do it. You have to focus on your patient that you have. Can't do anything without approval. You're not a nurse yet. You are learning. You're under my license, and we are going to work this plan that I have. This is with all our instructors. So what we did after we met, we got assigned our patients. What we had to do first and foremost, was we had to go and look at the chart for our patient. We had to see why they were here. We had to see their diagnosis. We had to see what medications they had due. And it was crazy because a lot of them, I don't know, a lot of them, we didn't have to pass a whole bunch of meds, right? So, um, if we had a diabetic patient, we're pretty much that's our patient. So if they had a blood sugar check, we had to do that. If they had insulin, we had to do that. But let me tell you how smooth these instructors were with it. There was always two instructors there. So one group went with one instructor, the other group went with the other instructor, right? So this these these are some nurses. So we would be in a group, and so the instructor would say, okay, you know what, why your patients here, you know their diagnosis, you know their medications, different things of that nature. So now you need to go do a head to toe assessment on your patient. So this is how she would have us start out. She would send us off to our patients, but we were only going to do a head to toe assessment. We weren't passing any meds at that time. We weren't giving any injections. We weren't doing any of that. We were strictly doing head to toe assessments. Now, mind you, we're on paper. So even though this was still the nurse's patient, what would happen is you can document a head to toe assessment on a patient at any time during the shift. You can do a head to toe assessment, and their actual nurse can do a head to toe assessment. So, what we had to do was we had to do the head to toe assessment. We had to write it out in our notebooks, and then we had to take it to our instructor for her to read over it before she would approve it for us to document in the chart. So we got that approved first. So when we had to give meds to that patient, we would get with the nurse, we would get the meds, then we had to take the meds to her. She had to check them. And at the time, she would be teaching at the same time. So I distinctively remember, I will never, ever, never, ever, never, never forget these two things regarding medications. There was a nurse that had to give a potassium pill. And so the student came to her. We're all in a group, and because she's keeping track of us, she's keeping her eyes on us. She's like, oh, hey, hold up. We gonna stay in a group. I'll send you off to do what you need to do. You come back to the group, stand here and wait. I'ma send you off to do what she need to do. We all gonna stay. So she's sending us off one at a time after we have done our head to toe assessments. So when it's time to pass meds, the nurse, the student came to her with the potassium, and then she was like, okay, okay, we're all standing in a group. And so she says, okay, you have potassium to pass. So she said, what are you going to do before you give this potassium? And the student was like, yeah. She was like, okay, you're going to check the potassium level. So go to the chart and check the potassium level and come back and tell me what it is. So he went and he checked the potassium level, and he said it was X, Y, and Z. And she said, okay, it's safe to give. Okay, you can go give your potassium. Next student had a diabetic patient. The diabetic, he came back and he was like, the patient's blood sugar is so and such. And he was like, the patient needs this amount of insulin. I've drawn it up and I'm gonna give. She said, stop, wait. She said, we don't give insulin until we see food on the floor. So she said, do you see the food carts yet? And then the student was like, no. She said, okay, we need to wait until we see food. It was about getting ready to be breakfast time anyway, so it didn't take that long. So we kind of stood there, and then boom, here came here came the food cart. And she was like, okay, it's okay to give. So he went in and he gave his insulin and he came back. So, I mean, this is the foundation to safe nursing that all nursing students should have. So, even when you get out there in the real world, these things stick with you and you know how to be a safe nurse, right? So I don't know what the fuck's going on today in these nursing schools, but some ain't right, and we need to you know it needs to be fixed because, like I said in my other video, doesn't matter if you've gone to CNA school, doesn't matter if you've gone to LPN school, doesn't matter if you went to RN school, it doesn't matter if you went to NP school, it doesn't matter if you went to PA school, it doesn't matter if you went to school, MD school. When you get out of school as a CNA, you're supposed to be able to function on the floor as a new grad CNA. You're supposed to be able to function on the floor as a new grad LPN. You're supposed to be able to function on the floor as a new grad RN. You're supposed to be able to function on the floor as a new grad MP. You're supposed to be able to function on the floor as a new grad PA. You're supposed to be able to function on the floor as a new grad MD, having finished his residency or whatever the heck you want to call it, right? If you had a good foundation in nursing school and the instructor did things in a way to make the information stick, when you get out there in the field, you're not going to deviate from that. I have yet to deviate. It's so goddamn. I have yet to deviate from the things that I learned in LPN school. Even when I went to RN school, I have yet to deviate from the CPNE that we did. The main thing that stuck with me in my RN CPNE was, if you don't take care of your patient properly, they could die, right? So, I mean, it's just like I don't understand how in today's nursing world we could have so many nurses that do not function safely on the floor. They don't have key key things from their nursing education that sticks with them and transfers over into the real world. I don't give a damn how bad the real nursing world is. If you've had a good foundation as a nurse, you're going to end up being a good nurse. If you had a bad foundation as a nurse and you're one of those nurses who is not willing to continuously learn, you're going to have a horrible nursing career. Now, it may seem like you're doing a good job and you're the best nurse in the world, or who cares, maybe not the best nurse in the world, but you are going to be functioning like a horrid nurse. You're going to be killing people, you're going to be sending people to the hospital, you're going to be um you're going to be passing the wrong meds. You're not going to know why you're passing these meds. You're not going to be able to deal with the patient. You're not going to be able to deal with the family because you don't have a good foundation. And then when you get out in the field, there's so many nurses that don't have a good foundation to where they can't even help you gain a good foundation. I mean, look at the problems that were just this young lady's just 2 weeks ago describing as far as lack of communication inside of a nursing facility that's supposed to be caring for people. Who are you caring for? Are you caring for anybody in here? Or are you just filling a building with warm bodies and do you not really give a damn about the nursing functions that's going on the floor? It's almost as if we don't give a damn. But anyway, let's continue.
She said, I'm showing you a little more than I need to, but I'm only showing you this because I'm I may work with you one day, and I want to make sure that you know what you're doing because I know what I'm doing, and my goal is to work and take care of these people. And I respected that. It was great. I gave.
Well, you see, I'm gonna tell you something. Her teaching her a little bit more than she's supposed to know or that she should know, which there is no teaching more that you're supposed to know as a nurse, right? As long as it's in your scope of practice, you can learn it, right? But this sounds like one of them good nurses that say, "Hey, listen, I'm a nurse. I'm I'm a warm body. I'm a nurse, but I'm out here and I'm doing things the way it's supposed to be done." that's a good nurse. So pretty much good nurses, we're out here on our own. There and for some reason you just can't get a group of good nurses, a group of them, a group of them. It's always something fucking wrong with these with two or more of these nurses. Always something wrong. Either one is a follower, or one is a bully, one is a liar, one is a scoundrel, one is you just can't have a group of good nurses that say, hey, we are here and we are here to take care of these people, and this is what we're gonna do. We're gonna do the job, we're gonna do it right, we're gonna get our checks, we're gonna go home, we're gonna celebrate the fabulous job that we did. We're gonna celebrate the fact that we sent 5 patients home in good condition. But anyway,
shots and like injections, and I did so many things. But and that was one of my short rotations, of course. But other than that, like other places, we were not welcomed, and some people let it be known that we wasn't welcome. It was even to the point to where we had to be pulled off the floor sometimes because the nurses were not welcoming, and then the um I don't know what her position is, like over the hospital, the director of nurses over the hospital, something like that. I don't really know what her position is, but she had to actually start coming and make it a point to where she had to go and talk to her staff, and she had to come and give us apologies and stuff.
she shouldn't have to do that. You see, here we go again. Here we go again. If you are a teaching hospital or you extend your facility to nursing schools, it should already be well established with your staff upon hire that this is a teaching hospital or we have extended our facilities to nursing schools. So we have nursing students that come in here pretty often to do their clinicals. So at no time will we be rude, disrespectful, nonchalant, dismissive, um, and not helpful. Yeah, that should be well established in orientation. And there will be consequences if a nursing student or an instructor comes to me and tells me, or it gets reported that the nurses on the floor are not, being kind, courteous, and extending their gracious help to them. Should be well established. There should be you. I mean, there should be no pulling staff off the floor to reprimand them because they don't know how to treat a doggone student. And this is what happens a lot of times when you have new nurses coming to who've sought employment, got hired, and now they're on the floor. You have nurses that are just rude, mean, and disgusting. And if you're gonna be rude, mean, and disgusting to me, I know that's how you treat these patients. I know it is.
For her staff, and the decision was that we would not ask their, like the outcome was that we would not talk to their nurses, we would not ask their nurses questions, we would not yeah, they wanted us to work at sea.
Well, no, I agree with that because see, the nurses there, they're working and they have to work safely and they have to work without distractions, unnecessary distractions. So the person that you are supposed to go to is your instructor. And when we had questions in nursing school, that's who we went to. We went to our instructor. We didn't ask another nurse. That nurse is not our teacher. That nurse is not our instructor. That nurse shouldn't be giving us any nursing advice at all we are there for is to say, hey, this is our patient. I'm going to be doing X, Y, and Z. And let me know if I'm in your way. And all questions should be directed to your instructor because she's having you learn according to the syllabus or according to the lesson plan or according to what the plan is for you guys to learn in that rotation, right? So your instructor really doesn't want you to get your information for the nurse on the floor because she probably asked backwards in the first place, like nursing is right now, asked backwards. That's why it's such a shock when you get out of nursing school and you get into the real world and you see what the hell are these nurses doing. So why would you even want to ask a nurse, one of these nurses on the floor, a damn question anyway? But at the same time, she wasn't understanding yet that the real world is totally different from nursing school. So probably if she had it to do all over again, she probably wouldn't ask a nurse shit. Go to your instructor who's supposed to know and have the answers to your questions. But from what she's saying, that didn't work out well either.
CNAs there, and I was telling them, um, I understand all that. However, I am still not CNA certified. Now, when I started the school program, they did say that it was a requirement to do the CNA thing. So when school started on July 5th, hey, that's funny. When school started on July 5th for everybody else, I actually had to start in June for about 2 weeks because we had to do the CNA course. And then we also had to do like the little clinical, which was 1 day of clinical and stuff. So they said that we were going to be able to sit for the test. And that was my plan, to sit for the test when I was able to. It was supposed to be October, November, something after our first geriatric clinical rotation. And I was going to sit for that, and I was actually thinking about going to try to get a part-time CNA job or something on the weekends or whatever, simply because I wanted to learn the skill of CNA. Now, I have been a DSP and all that good stuff, but I was never actually a CNA. So I wanted to go and learn the skills so that I could kind of be more help to my CNAs when I work with them, and I could kind of be a little more knowledgeable. But the school dropped the ball. Like, they had us to do all that just so we, it didn't work out because they didn't sign the paperwork that they were supposed to, and the new director didn't know this, and she didn't know that, and all this other
Mm.
stuff. So they kept saying that they was going to get it done, but they never did. And we kept asking, but they never did. But yeah, so they were telling us that they wanted us to come and do CNA work pretty much, and I was telling them it's certain things I would not do. Like, I would do vitals and stuff, and I would, like, yeah, I was doing vitals and I was just doing heads to assessments and stuff, but I'm not comfortable trying to transfer these patients. I'm not comfortable like trying to clean them up and do all this other stuff because I'm not able to do it. Like, I don't have a certification. And honestly, even then, like, my clinical that I had, it was cut very short. It was only 1 day and it was only a few hours. So it wasn't that much. And I didn't feel comfortable. I'm not going to put myself in this position. Now, I did tell them that I will, I could assist. Like, y'all can tell me what y'all need help with, and y'all can stand there and show me how to do it and stuff. But you're not going to leave me alone to like do this because I don't even want to play with these people like that, and I don't want to play with myself.
Well, technically, nursing students aren't supposed to be left alone with patients. You're not that patient CNA. You're not that patient's nurse. So if you are going to assist whomever is in charge of that patient, they're not supposed to leave you alone. You're supposed to consistently or constantly be under somebody's direction, whether it's another CNA, whether it's the nurse, or whether it's your instructor. But never should a student be left alone to care for a patient. Never should a student um, be left alone to transfer a patient, to you know what I'm saying, to do anything, to feed a patient, to anything. You shouldn't be left alone as a nursing student to do anything. And yeah. But that's how it be sometimes. Sometimes the staff think the students are there to give them some type of relief. No, the students are not there to give you relief. The students are there to learn from you. So it requires your presence. And then it requires that you're doing the correct thing. Otherwise, what is the student learning? Hogwash.
Stuff like that. So yeah, needless to say, we didn't last on the floor long. When we did go, we probably out of the whole clinical. We were probably up there on the floor for about 2 3 hours, and I was just checking vitals and well, like we was doing head to toe assessments. But I mean, you don't have to do that the whole shift. So we went downstairs and we were just talking and stuff. But yeah, the nurses were pretty much rude. It's like I don't understand. Like I feel like y'all have been here too, so I feel like y'all should be a little more understanding, you know. But at the same time, I do notice that a lot of people are burnt out, and that's another thing. Like I kind of don't want to do bedside. Like I know that's bad, but when I look at the opportunities for LPNs, it's not all bedside. It's a lot more options. So I want to try and go and reach those other things. Now I will do it to start off with if I have to and stuff like that. That's no problem. But that's not my goal. My goal is not to just stay a bedside LPN and stuff, working in a facility, a nursing home, or whatever. Like I it was ruined for me. Like at first, when I first applied for nursing school, I thought I was really about to go and do something. I was going to be a part of a team and all this other stuff. It was going to be great. That's what I thought. But yeah, it wasn't what I thought it was going to be, and that
Mm-mm.
was a harsh reality. So
Mm-mm.
it made me think, okay, well, I'm getting this out the way, but what else can I go to school for? So I've been thinking of that. How could I kind of use this to go to school for something else that don't have me on bedside? So I've just been doing research and stuff. Also, the way that these nurses be talking about how mean these doctors are, they talk about how rude and disrespectful they are, and the stories, and they making people cry and all this.
Well, here's the thing, and I'm gonna touch on this, and then I'm gonna go because I got some things to do. But I really wanted her to get on the part of the doctors, and I'm a doctor advocate. I really am. I cannot say that I've had a whole lot of bad experiences with doctors. But I'll tell you, if I did have a bad experience with it, well, I don't think I had a bad experience with a doctor. No, I can't say that I've had a bad experience with a doctor because of something that I did. I've had maybe come across a doctor that probably was an unhappy doctor because they recognize when nurses aren't functioning properly as well. So I wanted to say this about the doctors. It is because when nurses call the doctor, 9 times out of 10, they have not done what they were supposed to do. So before you pick up that phone and call the doctor, there are things that are necessary so that he can make a determination of what needs to be done. And the reason being is because he's not there in the facility looking at the patient. So he's counting on you and your assessment and your knowledge. And he's going to go off of, he's going to make his decisions and his orders based off of what you tell him and what you describe to him. So, for example, your patient is having, um, let me see, let's see, your patient is having uh, some high temperature, right? Your patient has the temperature of, I don't know, 102.5. So, what you're going to do first is you're going to do some nursing interventions, right? You're going to look to see if the patient has some Tylenol for a temp, not Tylenol for pain, but Tylenol for a temp. They don't have any Tylenol for a temp. So, what you might want to do is you want to bring that temperature down. You want to try to bring it down fast. So, you want to get you some ice and you want to ice the axilla area, right? You want to put some ice in a bag. You want to cover it with um, a washcloth or some type of barrier to prevent the ice from sticking to the patient or whatever. You want to do that. You want to try to bring the temp down while you're doing that. Since you don't have an order for any Tylenol for a temp, you also want to look and see, is the patient on any antibiotics. You want to does the patient have any wounds? Does Has the patient had a previous so you want to do your research, right? The patient, yes, the patient is having a change in condition, but you've intervened with the ice, so it's going to give you a little bit of time. You have the CNA take the rest of the vitals. You have the CNA stay with the patient. You can always bring your portable laptop to the room, do your research from the room, but you want to be looking up all these things. Okay, they don't have an order for a Tylenol for a temp. They don't have any wounds. They're not on any PO or IV antibiotics. Since they've been here, this is the first time they've had a temp. Um, you want to pretty much look and see if they are voiding properly. You want to ask the patient some questions like, hey, are you having trouble peeing? Yeah, I'm having some burning and, some, hard time peeing. Okay, patient might have a UTI, right? So now you've gathered your information. You want to look and see if they've had a UA done, because a lot of times the patient had a UA, damn UA CNS, ain't nobody called it, ain't nobody did nothing for it, right? And it could be that they did have a UA CNS, and they're supposed to start on antibiotics, but nobody called the order to the pharmacy or faxed the order to the pharmacy, so they ain't got no the antibiotics. Or yeah, they got a UTI and you wait for the antibiotics to come in. So you have to make sure that before you call the doctor, you've done your research, you've done your due diligence, you have tried to figure out everything that's going wrong with this patient. But some nurses, what they'll do is they'll call the doctor and they'll say, Doctor, the patient got a temp of 102. And then the doctor and they don't have no Tylenol for a temp. They got Tylenol for pain. Can I give them some Tylenol for a temp? And then the doctor will say, well, is the patient on any antibiotics? And the nurse is like, oh, I don't know. Okay, well, what's the UA results? Oh, let me look. What, so you're basically coming to the doctor and you have no information to give him except the fact that the patient has a temp. So the doctor is going to say, okay, yeah, you can give Tylenol for a temp, but why is this patient having a temp? What type of assessment have you done? What type of information have you gathered to give to me so I can determine some other steps aside from Tylenol? Because obviously when the patient has a temp, it says that something is going on, right? So that's one scenario. And then the doctor is fucking pissed. And he's like, well, who the fuck is this nurse? He's calling the DON like, oh, well, who is this nurse you got calling me and telling me this patient got a temp and she ain't got no information for me? They get pissed. And nurse after nurse after nurse after nurse after nurse is doing the same thing. And that's why the doctor is pissed and he on the phone with the DON and he's trying to say, what the fuck is going on with your nurses that they're calling me and they ain't got no information for me? And then the DON is like, well, you got to calm down. It's not the nurse's fault. And then she's trying to protect the nurses instead of you got five nurses. He didn't say, listen, bitch, I don't have five nurses call me with inaccurate or incomplete information, and I don't know how to take care of the patient because I'm not there, and you ain't did shit about it. So then you get a nurse like me that comes to the facility to work at the facility. Okay, the patient got a temp. Okay, well, yeah, I see they got a order for Tylenol, but they don't have an order for Tylenol for a temp, which means that's telling you they don't have Tylenol for a temp because the doctor wants to be notified that the patient has a temp. They don't want you to uh, sneak and give the patient some Tylenol for a temp and then you don't call him, right? The doctor wants to be notified before we intervene with Tylenol for a temp. We got to find out what's going on. So, a prudent nurse does her research. When she calls the doctor or the NP and she says, yes, hello, doctor, I'm calling you in regards to patient so and so. The patient has a temp. Now, this is the information that I've gathered. The patient does not have a recent UA. The patient has not had a temp since they've been here. The patient doesn't have any wounds, so I don't suspect a wound infection because there's no wounds. However, the patient does have a Foley, and he is complaining that he's having some burning in the penis area, vaginal area, urethra, whatever, right? So then the doctor is going to say, okay, well, go ahead and get a UA CNS, give Tylenol 650 milligrams Q4 hours PRN for a temp greater than 100, and increase fluids. Also, and then you might say, okay, well, doctor, can we get an order for some pyridium for the patient to relieve some of the pain that he's having in the urethral area? Sure, do pyridium, well, 5 milligrams, I don't know, 3 times a day, for urinary discomfort, something like that. Okay, bam. The doctor is like, ooh, who is this nurse? You're collaborating with the doctor. You're collaborating, and if you ain't got no information to collaborate with him on, what he supposed to do? What he supposed to do? So you don't want. So the reason you look to see if the patient has had a recent temp, because you want to see what was done before for the previous temp. Did the patient end up having an infection? Did the patient get a UA done? Did the patient get their antibiotics? Because a lot of times when you do research, you be like, dang, this patient had a UTI, was treated for a UTI 2 weeks ago, but I see here in the MAR, the patient refused 6 doses of a 14-day order for antibiotics. So she fucking still has a UTI, right? You got to know this information so that when you come to the doctor, you can say, yes, doctor, the patient had a temp 2 weeks ago. We did a UA. He had a UA CNS done. He had greater than 100,000 of E. coli. A 14-day supply of Cipro was ordered, but the patient refused 6 doses. So the doctor's going to say, oh, well, the patient probably still has a UTI. So go ahead and get another UACNS, get the urine first, and then let's start the patient again on Cipro, whatever, or let's wait till or whatever the hell. Right, but you have to have some information so that you can communicate effectively with the doctor. It's a it's a dialogue, right? The doctor doesn't want to do a monologue. He don't want to be telling you to do shit one-sided, and he don't know what's going on with the patient. You ain't got no information for him. So he's basically troubleshooting. What if the patient doesn't have a UTI? What if the patient has a blood bacterial infection and the doctor says, okay, well, yeah, the patient, this is the first time they've had a temp. They were admitted for blah 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 blah, and so the doctor was like, okay, well, maybe they develop. Okay, let's do blood culture times three. Blah 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 blah. You come on now. You can't just call the doctor and be like, doctor, your patient got a temp 102.8. What you want to do? You want to give him some Tylenol or something? He's going to be pissed off. But this is what's happening globally. This is why these doctors are pissed off. This is why these doctors are upset. You have some doctors that I mean, I knew this one doctor, okay? He has several facilities. He could tell you the first and last name of every single last one of his patients. That's how invested in his world he was. How invested in his patients that he was. So when you call him and say, Doctor so and so and so, so okay, he know exactly who the patient is. He know exactly what's wrong with the patient. He know, okay, yeah, this patient tends to develop blah blah blah. So go ahead and do X, Y, and Z and different things of that nature, right? But globally, these nurses, they don't know how to communicate. They don't know how to report. They don't know how to research. They don't know how to do shit but pass the pill, get their check, and go home. They don't even know what the damn pill is for. They don't even know, anything. And it's not totally their fault. It's because nursing is a forever learning field. You have to invest in your nursing career. You have to want to know. You have to you have to be a verbal person. You have to be a person that communicates. You have to be basically you have to be nosy. They say that's the best nurse, a nosy nurse. right? Not nosying and well, at the beginning of your life, yeah, you're nosying in other people's business until you find the direction that you need to go in. So if you find the nursing field, nosy is exactly what they need, because I want to know everything. I want to know when the last, if they ever had a temp. I want to know if they have been on antibiotics. I want to know if they got wounds. I want to know this. The patient could simply be dehydrated. What's the most recent BUN? Well, doctor, I looked and on lab results, the labs were drawn 2 weeks ago, and the BUN, it was 25. It wasn't all that high, but I don't know. He's gonna say, okay, do a CBC, do a CMP or a BMP. You won't find out what's going on, right? You gotta, and then according to your patient's diagnosis, you can pretty much troubleshoot and be looking around and researching and seeing what's going on with this patient, so that you have the information for the doctor. It might not be, and the damn doctor appreciates wrong information. You know why? Because he said this fucking nurse did her research. At least she did some type of damn research. She just called me with some bullshit. But they get very pissed off because they are not there to see the patient. And then you mean to tell me you're the nurse, you've been taking care of this patient all day or for the last 3 days, and you just gonna call me with some bullshit? No, you better have like several pieces of information for this doctor so he can determine what he needs to do for this patient. So this is why doctors are mean. This is why they're mad. This is why they're rude, because they fucking tired of it. And when they call the DON on the phone, she acting like what? Well, you can't just be hot. This shit turn it into where you can't just be yelling at the nurses. Why are you yelling at the nurses? What the fuck you mean? Why am I yelling at the nurses? Because this bitch is stupid, and they will call you. Oh my god. Whew. Yeah, it's the real world. And if you aren't learning what to do on your own, pretty much you're not gonna get taught. So being a nurse is like being an independent contractor. Being a nurse is like being a nurse consultant with your own nurse consultant business. When you go up in that nursing, when you go up in that nursing home, you go up in that hospital, ain't no damn team. There's a I in team. I, you, yourself, and you. I. There's no team. Everybody is doing their own thing. Everybody is basically in charge of their own practice, and there's no team. So when you come in, you better know what you're doing. This is why when this young lady went into the nursing home to get a job, she got a job, she didn't have her license yet. And she's wondering, like, why the fuck I can't get an orientation, honey? Because they found the I in team. And it's just you. And whatever knowledge you come in with, baby girl, you better make it work for you. Because we not gonna teach you nothing, as evidenced by the orientation that you had. You are an independent contractor, and you need to come with the information that you need to know, or you need to know how to find it, because ain't nobody gonna tell you shit. Nobody's gonna teach you nothing. Nobody gives a shit what you know. Nobody cares about your nursing practice but you. Okay.
Other stuff, y'all. I said, oh no. Now I do understand that it's stress with everything. Everything's not perfect. You're not gonna be happy with everything and all that good stuff. But it's just like I don't want to. I want to be as peaceful as possible, you know. And I'm going to be respectful, and I hope that people will be respectful to me. And sometimes people are not, and I can't control that. I can just control my part, I can just say my okays, and I can say, it is what it is, and I can just let it flow off. But I don't want to have to deal with that every day. So
Well, here's the thing. In nursing, you have to be tough, right? In nursing, you have to be tough. Um, the only time you're going to be babied in nursing is when you one of them nurses that throw your life away for the facility. If you always there, you ain't never complaining. You always available to work, right? They're going to baby you. If you one of them nurses that's like, I'm not throwing my layman's life away for this building, honey, you gotta be tough. You got to be tough. Because a lot of times it ain't the nurses on the floor that's being mean to you. A lot of time management is mean to you because you're not doing what they want you to do. You're not throwing your home life away so that they can to work so that they can have a good home life. So see, when they get the nurses to throw their lives away, uh it enables management to go live their life and have a good time and go home and unwind with a little wine. Some of them go home and smoke a little weed. Some of them do happy hour. Some of them get home and they cook dinner for their family and sit around a table and have dinner with their family. Some people in management go over to each other's houses and have a good time. And we at work busting our ass, throwing our life away. So if you're not willing to do that, you got to be a tough ass nurse. So when you're coming across these instructors that's not babying you, or you're coming across these instructors that, you know, got their issues, honey, take it as a learning experience, okay? Because these are the same types of nurses that you're going to be dealing with out in the field. You're going to deal with mean ones, nice ones, happy ones, sad ones, high self esteem ones, low self esteem ones, abused ones, abusers, alcoholics, uh, crack smokers, heroin users, pill poppers, pain pill poppers, Ativan, Xanax, Clonopin. You're gonna be dealing with drug. You're gonna be dealing with all kinds of nurses. Nurses gonna be coming to work high, drunk, stupid, incompetent, mean, nice, low, all different kinds. So you have to be strong, and you have to pretty much know what you're doing. And if you don't know what you're doing, you're going to have to figure it out safely. So, anyway, I got to go. I will be back here with another video. I know I'm supposed to do the Google reviews, and I'm supposed to do the state inspection reports. So, I have just yet to put that together. I'm going to put it together, and I'm going to do those lives. So, anyway, I will see you guys in another live, and y'all have yourself a good night. Please do not forget to like, subscribe, and share and comment. Thank you.